Doctors. What does medicine still not know about the human body? I have a very narrowly specialized answer. We do not know what substance should normally bind to the site that benzodiazepines act on. Benzodiazepines, BZDs, are drugs like Xanax and Valium. They have a calming effect and possess a very specific chemical structure that fits perfectly into the BZD site within a group of 5 proteins. But we have absolutely no idea what is supposed to occupy that site under normal conditions. Many medications are analogs of natural molecules that we copy to produce a desired effect. In other words, the BZD site is meant for something, but we still do not know what exactly. Couldn't we just take people without anxiety, do such people even exist, and see what is present in that site in them? That would honestly be a great approach. But it's not that simple. Anxiety is difficult to describe and define. It's not blood pressure that can be expressed in specific numbers. In addition, anxiety can be caused and suppressed by many different factors. It is regulated by far more than just this single receptor in the mentioned group of proteins. And by the way, benzodiazepines are not the first or even the best treatment for most types of anxiety. But yes, studying people without anxiety to understand whether there is something in their bodies that people with anxiety lack would be a good starting point for research. One of the few absolute facts in medicine is that people who are born blind never develop schizophrenia. I am an obstetrician-gynecologist. We still do not know what exactly triggers labor. We have studied the mechanics and physiology extremely well, but we do not know what makes the uterus decide that it is time. I am an anesthesiologist. We still do not know exactly why inhaled volatile anesthetics such as sevoflurane, the main drug used to maintain general anesthesia, work. We have a rough idea of how this happens, but in reality, we simply do not know. In my field, people often say that whoever figures this out will receive the next Nobel Prize in medicine. I am a doctor. I can immediately name several things. We still do not understand how anesthesia actually works. We only know that it produces certain effects, and therefore we use it. Second, psychiatry is still incredibly primitive in its understanding of human disorders. This field is constantly changing. We do not know much even about the drugs we are currently using. And diagnostic criteria for disorders continue to change as we realize, hey, maybe all these symptoms do not belong to the same disease. Making a diagnosis is extremely difficult because the criteria are largely based on patient descriptions and subjective observations. Third, to a lesser extent than psychiatry, but neurology still has a lot that remains unexplored. It is easier here because we can observe objective indicators, unlike psychiatry, but we still poorly understand how the brain actually works. Fourth, immunology. Don't even ask, because in reality nobody really knows anything. Fifth, yawning. There are only assumptions as to why it occurs. There are theories, but nothing more. Regarding points 2 and 3. About 10 years ago, I suffered a severe traumatic brain injury. Surprisingly, there was no damage to my neck, even though the injury was serious. I fell off a horse, it flipped over, and I fractured my skull when the horse kicked me. Already 45 minutes after such a fall without a helmet, I was able to stand up and walk, which apparently means that I have the best guardian angel in history. But the consequences of the injury were very strange. Describing them in detail here would take too long, but they caused such significant changes in my personality that for a long time I felt as if something inside me had broken. I underwent neuropsychological testing, which showed that my cognitive abilities had not statistically changed after the injury. I had results from similar testing done before the injury, which was probably interesting for the doctor, since few people have neuropsychological data from both before and after such a serious TBI. However, this did not answer the question of why I felt that something inside me was wrong. Eventually, I realized that our brain and consciousness are entirely biological. A strong blow can fundamentally change us, which means that everything we are exists physically within us. I felt like a different person because I became a different person. In a sense, the old me died at 19, and a new one was born at the same time. Very little is still known about how the immune system works. For example, we still have not figured out autoimmune diseases, multiple sclerosis, lupus, and others. We only know that at some point something switches inside the body, but what exactly and why is not fully understood. This happened to me 15 years ago. The doctor explained it to me as a switch that got permanently stuck in the on position. Within 6 months, I went from being a healthy person to a state where I could no longer walk, before finally receiving a diagnosis. It is also not uncommon that after diagnosing one autoimmune disease, patients are soon diagnosed with others as well. I have ulcerative colitis, an autoimmune disease in which the large intestine becomes inflamed. Every time I have a flare-up of colitis, my kidneys also start malfunctioning, and interstitial nephritis develops. I was told that this is extremely unusual. I gave permission to a colleague of my doctor, a gastroenterologist, to write a scientific paper about me. All my autoimmune problems began several weeks after a strong course of antibiotics that I took because of an abscess on my gum. I am convinced that the state of the gut microbiome plays a huge role in my case. Interestingly, I have had no symptoms and have not taken any medication since I had children. I have a theory that I restored and balanced my gut flora by eating from the same plate as my children from a very early age, and also because they constantly get everything dirty and drool everywhere. I am a sleep specialist. We have good theories about some functions of REM sleep and its effects on the brain and health, but we still do not know why we dream. For example, why we see dreams at all and why dreams have some kind of storyline rather than being a random set of meaningless images. Unfortunately, it is unlikely that this question will ever be answered. Here is another thing that has not yet been mentioned. We still do not know exactly how our body distinguishes between gas and feces. We have certain assumptions. And it is known that there are many nerve endings in the intestinal area. But the exact mechanism by which the body tells the brain this is just gas, you can relax, has not yet been studied. I am amazed at how obvious this distinction is, given that we are able to pass gas without any problem even while asleep. Apparently, this difference is hardwired somewhere at a very deep level. My father always says that the sphincter is the smartest muscle in the human body, because it can distinguish three aggregate states of matter: solid, liquid, and gaseous. I am not a doctor, but a scientist. We are currently working on the connection between the gut microbiome and neuropsychiatric diseases and brain aging. For example, it is known that people with inflammatory bowel diseases more often suffer from dementia, anxiety, and depression, but we still do not understand why this happens. This also applies to the influence of nutrition in general, because studying it effectively and ethically is almost impossible. For example, any experiment studying the long-term effects of consuming a specific food is, at best, unreliable. People find it difficult to consistently follow a single diet. Even if someone strictly adheres to it, it is hard to objectively confirm this. People do not often report what they ate, and since diets are usually very diverse, proving a cause-and-effect relationship rather than a simple correlation is almost impossible. In addition, studies are often funded by the food industry, which adds potential bias. Under such conditions, how can a proper experiment even be organized? As an example, the largest and most detailed study on the harmful effects of saturated fats will never be repeated for ethical reasons. In that experiment, patients in a psychiatric hospital were put on a strict diet for a long time. The results showed that those who consumed more saturated fats had higher cholesterol levels, but at the same time better overall health indicators. Since the experiment did not produce the expected results, it was not fully published, and only decades later were the data republished. When one of our most basic beliefs, saturated fats are bad for health, is called into question, how much do we actually understand at all? The female body is, in principle, poorly studied from a medical standpoint. Almost all data are based on studies of men, and often exclusively men. This really infuriates me. The rules of clinical trials need to be changed so that both sexes are represented. The criteria for selecting participants almost always sound like this: healthy men and postmenopausal women. Even though women's hormones have a huge impact on their health throughout most of their lives, this is practically not studied. Women often struggle to receive adequate medical care. The answer to many problems sounds like, it's just anxiety, depression, or because you're a woman. For example, Viagra significantly reduces menstrual pain, real pain that most women experience monthly. However, research in this area was stopped, and the drug was not licensed for use in women. Meanwhile, men were literally given erections, because this effect of Viagra was extensively studied. It turns out that men's sexual pleasure is more important than the pain women experience for nearly a quarter of their reproductive lives. In human cells and in the cells of most other eukaryotes, living organisms whose cells contain a nucleus, there are organelles called vaults. They consist of 70 copies of a single protein. In size, they are approximately 3 times larger than ribosomes and larger than most viruses. The functions of vaults are still not fully understood, but they are presumably related to the functioning of the cell nucleus. Analogues of vault genes are found even in bacteria. Since vaults are present in a very large number of species, this means that they appeared at early stages of evolution. The similarity of the genes encoding these proteins across very different species suggests that vaults are important for life itself. At the same time, laboratory experiments have not shown significant harm to animals in which vault genes were artificially switched off. Even more surprisingly, some classical model organisms that were used in laboratories long before the discovery of vaults in 1986, for example, nematodes and the fruit fly Drosophila, naturally lack these organelles altogether. Once, a pathologist told me that the most interesting part of his job is not determining the cause of death, but the opportunity to see how many things can be wrong in the human body, so many potentially fatal pathologies, and yet the person was still alive and functioning. A good friend of mine had pneumonia. He was too busy at work and could not afford to take sick leave. He simply continued taking over-the-counter medications to relieve the symptoms. He died alone, so a forensic expert had to be involved and an autopsy was performed. They found cancer in 3 different places in his body, yet he continued to live and work until the very end. He was a tough old man. With many medications, it is still unclear how exactly they work and whether they work at all. For example, if you look at studies on the effectiveness of popular antidepressants, it seems that they barely work. And yet almost every one of us knows at least one person whose life was literally saved by a specific antidepressant. When a doctor prescribed propranolol to me for migraines, he said something like this: "This is a blood pressure medication, but it also helps with migraines. Nobody knows why, but it works, so we prescribe it." And he was right. It really helps. I think the problem is also that not everyone who is diagnosed with major depressive disorder, MDD, actually has it as the primary condition. I was diagnosed with MDD many years ago, and absolutely nothing helped me. Neither medication nor cognitive behavioral therapy, nothing at all. When, already in my 40s, I received a diagnosis of ADHD and started taking medication, I have not had a single serious depressive episode since. It turned out that MDD was not the cause of my condition. It was only a symptom. It turns out that we know almost nothing about fibroids, which develop in approximately 75% of women over the course of their lives. What is especially striking is that the largest fibroid ever removed weighed 45 kilograms. The problem is clearly not minor. There are theories about the influence of hormones and risk factors, but apart from surgical removal of existing fibroids, there is practically no information on how to prevent their recurrence. My wife was found to have a fibroid, and she was told that she might have cancer because the fibroid was growing quickly. I studied the issue in detail and found out that a fibroid can indeed transform into a malignant tumor. But the probability of such an event is approximately 1 in 10,000. And almost all cases occur in menopausal women. In addition, the rate of fibroid growth is no longer considered an indicator of malignancy, and in my wife's case, the growth rate did not even meet the former criteria for rapid growth. Thus, the doctor's statement was not directly false. In the end, anyone can have cancer, but it clearly caused far more anxiety than the situation warranted. I am not a doctor, but the number of answers like this that I received from doctors during my breast cancer treatment was simply astonishing. I am not claiming that doctors are useless or did not know what they were doing. I simply asked a lot of questions. Why do I need to take Claritin before chemotherapy? The nurse, it helps with bone pain. Interesting, and why does that happen? Nobody knows. What are these strange long lumps that appeared in my arm after the mastectomy? The physiotherapist, nobody knows exactly what they consist of or why they appear. Why did I suddenly stop tolerating gluten after cancer treatment? The gastroenterologist, I don't know. Having survived cancer, I finally understood how much of a mystery the human body still is. The story with gluten is especially interesting. My son had an infection of the tibia when he was 4 years old. We never found out where it came from, and the doctors never determined which bacterium caused it. In the end, he was prescribed an antibiotic that he took orally for 50 days. Immediately after that, he unexpectedly developed celiac disease. An autoimmune disease is usually hereditary, although no one in our family had it. Perhaps chemotherapy caused a malfunction in your immune system as well, which made the body start attacking the intestine when gluten is consumed. Human bodies are really a strange thing. I hope you have already completely beaten cancer. How exactly do we regain consciousness? Once I lost consciousness, and it was documented. I was playing on a university football team and received a very severe concussion that completely knocked me out. Despite this, I continued training. On the recording, you can see me giving commands, making tackles, and playing as usual. It was the best practice of my life. I am now 38, and I still do not remember that day. I watched the recording. It was me. I was playing, but I remember absolutely nothing. It is terrifying and at the same time impressive what the human brain and body are capable of when completely deprived of conscious control, acting purely on autopilot. It took me a long time to recover from that. My teammates said that I delivered the best game of my life, and I simply do not remember it. Very creepy. I am a dermatologist. We do not know what exactly causes itching at the molecular level. That is why it is so difficult to find effective treatment for patients with itchy skin. If I am not mistaken, doctors still do not have a clear understanding of what causes migraines. Edited. It took me years to find my trigger. Sleeping on my back, which worsened apnea. Twice a month, I would wake up at 4 a.m. with a terrible headache and then vomit every 20 to 30 minutes until 2 p.m. I could not eat, drink, take medication, drive, talk, watch TV, or even think properly. The entire day passed either on the bathroom floor or in bed in a semi-delirious state from pain. About 4 years ago, I got a cartilage ear piercing, a daith piercing, and it completely changed my life. After that, migraine attacks with vomiting can be counted on the fingers of one hand. Now, if I wake up with a migraine, I vomit at most once. I take a painkiller, lie down for an hour, and after that I feel as if nothing happened. It seems to me that migraine is one of the most controversial medical problems. Ask any person who suffers from migraines, and they will tell you about the absolute chaos in which triggers and treatment methods exist. Everyone is different. I understood the cause of my migraines only after 10 years. The main difficulty was that my mother and sister also had migraines. My sister's migraine stopped after pregnancy, my mother's after menopause, so my migraines were also considered hormonal. In reality, my attacks were caused by birth control pills that I was taking. Nobody could figure this out for 10 years. Not a gynecologist, not a general practitioner, not a neurologist. Only a nurse suspected something was wrong. The difficulty was that I still needed to take birth control because of a blood clotting disorder, so I could not stop them. But after switching to different pills, I completely got rid of migraines. I am a mental health specialist. I can say that we still know extremely little about the mechanisms of schizophrenia and bipolar disorder. We know some details, but the overall picture remains very confusing. I have bipolar disorder, and I study in detail all the medications I take. It is astonishing how different all medications for bipolar disorder are from one another. How is it even possible that a damn mineral, lithium carbonate, can be as effective as powerful antipsychotic or anticonvulsant drugs? What the hell is this stuff? Allergies, especially food allergies. Why do adults suddenly start suffering from allergies when they never had any reactions before? Encountering a new allergy is brutal, because it often takes a long time to figure out what exactly caused it. You always ate certain foods without any problems and never think that an allergy could suddenly appear. I loved pistachios since childhood. For me, it was a special holiday nut. My mother always decorated the Christmas table with nuts and fruit. I even loved sucking the salt off the shells. One day, already as an adult, during a Christmas dinner, I ate a pistachio and suddenly my throat started tightening. I was terribly frightened, but after a few minutes an antihistamine worked. The only new thing I had tried that evening was some hibiscus tea lemonade prepared by my sister. She was experimenting with healthy recipes. I was sure the problem was that drink, so I simply poured it out and drank only water. A few minutes later, I ate another pistachio, and everything happened again. By the way, the following Easter I found out that my stepmother's green salad jelly was made from pistachio jelly. And I had a reaction again. That time, I could not understand for a long time what was going on. Why would there be nuts in jelly? I thought it was some kind of fruit. Oh yes, allergies are really a sore subject. You know that every time you hear my nasal or tired voice, in most cases, it is exactly that. Unexplained infertility. That is exactly how the diagnosis officially sounded that was given to me and my wife. According to all existing medical tests and the knowledge of modern medicine, everything is fine with us. We should be able to conceive a child. All indicators are normal. Perhaps each of us could have a child with a different partner, but for some reason, together it does not work, and there are far more such couples than is usually spoken about openly. But the only diagnosis we receive is unexplained infertility. My husband and I were diagnosed with male factor infertility. For years of trying and nothing. But one day I unexpectedly became pregnant. There was a miscarriage, then I immediately became pregnant again and gave birth to a healthy child. What suddenly changed? Fertility is a very strange thing. And another oddity. If you manage to conceive a child using assisted reproductive technologies, then the chance of getting pregnant again returns to a normal level. 80% of couples become pregnant within a year. It is as if the IVF procedure serves as an instruction manual that teaches the body. I had unexplained infertility. I gave birth to my son thanks to IVF 20 months ago after 3 years of active attempts and 7 years without contraception. And now I am pregnant again, already in my 31st week. And this happened on its own. We were not even trying on purpose. I am not a doctor, but when I found out that I was going to have identical twins, I started studying the biological processes that lead to their appearance. And it turned out that nobody really knows why this happens. There is a lot of information about what type of twins will result depending on the moment when the zygote splits, whether there will be a shared placenta, a shared amniotic sac, or whether the twins will be conjoined. But why does this happen at all? There is also serious disagreement in the medical community about whether heredity plays a role. We still do not know what exactly causes ADHD, attention deficit hyperactivity disorder. That is why many people still do not consider it a real disorder and think that it only affects concentration. In short, so as not to turn this story into a lecture, there is one very active area of the brain that does many things. What exactly it does, we do not know, but there are many signs that it performs a very important function. This area is called the claustrum. According to one theory, the claustrum is responsible for consciousness itself. Well, returning to ADHD. ADHD is diagnosed in 2 to 5% of people. If you spend time on social media, you understand that this is a huge number of people. In addition, the leading causes of death among people with ADHD are suicide and homicide. Yes, if you have ADHD, the likelihood of dying by your own hand or by violent death is higher than living to old age. This sounds terrifying, but the fact remains a fact. What we know for sure is that the claustrum shows increased activity in people with ADHD. It is known that if the activity of the claustrum is suppressed in rats, they begin to behave strangely and chaotically. If one day we better understand the function of the claustrum and it turns out that it is precisely responsible for the development of ADHD, the general public, especially parents of children with ADHD, who much more often abuse their children, will finally understand that children do not behave badly out of spite, not because of a lack of discipline or behavioral problems, but because of a disease much closer to epilepsy than is commonly believed. Such a change in thinking would save many lives. I hope that someday the functions of the claustrum will be clearly and precisely described and understood. Yes, also a very familiar problem from childhood. Constant remarks from teachers like, maybe you should buy a pillow or something. I heard a lot of that. And by the way, the frequently misread words that you hear from me are also a consequence of that same ADHD. We are still unbelievably ignorant when it comes to the human body. I am a neurologist. I still do not know exactly how anesthesia works. We have theories, but we do not fully understand the mechanism. The fact that anesthesia works at all is almost a miracle. Many psychiatrists do not know exactly how antidepressants work. We know that they affect neurotransmitters, but the real mechanisms are still unclear. Moreover, in many patients antidepressants do not work at all. I am a medical researcher. I study sleep. We do not know exactly why we sleep. There are many theories, but none of them fully explain the process. One of the main hypotheses is that sleep allows the brain to clear metabolic waste products. However, if that were the only function, why do some animals sleep much more than others? We also do not know why people die in their sleep. It is often said that they die from heart failure, but that is not an explanation. Why does the heart suddenly fail during sleep? That remains a mystery. I am an immunologist. We still do not know exactly how vaccines work. We know that they train the immune system, but the precise mechanisms that determine why one person develops strong immunity while another does not are not fully understood. Autoimmune diseases are another huge unknown. Why does the immune system suddenly start attacking the body itself? Why does it target specific organs? We have theories, but no definitive answers. I am an oncologist. We still do not know why some cancers suddenly disappear on their own. Spontaneous remission exists, but we do not understand why it happens. I am a surgeon. We still do not know exactly why some wounds heal perfectly while others, with the same treatment, become infected or heal poorly. I am a geneticist. We still do not fully understand how genes interact with each other. We know individual genes, but the complex network of gene interactions remains largely unexplored. I am a cardiologist. We still do not know why some people with severe coronary artery disease live long lives, while others with minimal disease die suddenly of heart attacks. I am an endocrinologist. We still do not know exactly how hormones interact in the body as a complete system. Changing one hormone often has unexpected effects on many others. I am a pediatrician. We still do not know why some children develop normally while others, with the same environment and genetics, develop disorders. I am a pathologist. Even after death, we often cannot say with certainty what exactly caused it. The more we study the human body, the more we understand how little we actually know. And that is both terrifying and fascinating at the same time.